Hi, everybody. Welcome. My name is Jessie Haas. This is Pet Partner Session that we call Volunteering with Your Pet. And this is a session that we really designed for prospective volunteers primarily because we're going to walk through, what it means to be a Pet Partners volunteer and how you get there. But if you are a current volunteer and you're listening, please feel free to hang out. You can help me answer questions in the comments, share your insights, your experiences with Pet Partners. But yes, it is mostly a session for our prospective volunteers and those who are considering whether or not they want to join Pet Partners. Before I go any further, I actually want to just check and make sure folks are hearing me, that you can find the space to comment as we go through today, because I do want to hear your questions throughout. So if you could start by telling me where you're from, that would be great. And also what kind of animal you have. So do you have a dog, a cat, a bunny, a horse? I'm looking for your species type, just so I can kind of get a sense of who is out there. I'm just going to wait a second to see if these comments come in. Sometimes it takes a minute. Hey, Bree from Reno with her bunny Theo. Great. We love to hear from our bunny owners. Um, for a few more to come in. You're also welcome if you want to drop in the comments now, or you can do at any point during the presentation. If there's something you really want to make sure that I answer today, I can take that now and make sure I weave it into the information I already have prepared for you. Hey, Liz from Richmond with a dog, and Barb from Indiana also with a dog. St. Louis with a dog. I'm going to be in St. Louis this weekend visiting some friends and family. Um, we've got more puppies, more dogs. So we got a lot of canine handlers today. That's not uncommon. Canines make up about 94% of the animals that we register, but we're actually going to talk about that a little bit later. Um, so now that I know people can hear me, we can go ahead and get started with our first slide of information. I always think it's helpful during these presentations to sort of start by giving you all some context. So what does it look like to volunteer? Where do you go? What is the commitment? And then after that, I sort of back it up a little bit and talk about the requirements to be a Pet Partners team and what the process is to actually get there to become a volunteer. But I think the context is really important because it helps explain, why we have the requirements and the process that we do. So with that said, places where therapy animal teams visit, and we use the word visit as in volunteer. So you're providing a therapy animal visit to people in your community, and that is your volunteer effort. So up on the screen, you'll see the places that are most common for our teams to visit. This is not an exhaustive list, but it is pretty representative of where most of our teams go in and provide their time to the community. Go to the next slide. In terms of what a therapy animal visit looks like, just like with facilities, they can be quite diverse. A lot of our visits are what we might call social visits. And I don't mean to use the word social to kind of lower its value. In fact, social visits can be a wonderful way to reduce isolation, to provide company for somebody, to brighten their day. But a lot of our visits are indeed social in nature. So when a team goes into a hospital environment or, say, a rehab environment, and they are chatting with somebody who is at that hospital or at that rehab center for several days or several weeks, that is a social visit. The same kind of thing often happens at nursing care facilities or senior care homes, where teams will go in and they'll spend time with either a group of residents, clients, patients, or they might do one-on-one visits, maybe 4 or 5 or 6 one-on-one visits during the hour that they're there. These are all social visits in nature. Kind of on the other end of the spectrum is something a little bit more formal in terms of type of visit, and that is when our teams might pair up with a professional, say a physical therapist or an occupational therapist, and the team goes in as part of maybe a treatment or an appointment. And obviously, the professional kind of owns the outcome of that appointment, but the team might provide some services that help them get to that outcome. So consider a physical therapist who is working with somebody who needs to regain some fine motor skills in their hands, let's say. The dog may be pet, and that can be a great practice for fine motor skills. Maybe the opportunity to hold a brush and to brush the dog. This can provide some obvious motivation and kind of a little bit of fun into a treatment session coordinated by, like I said, a physical therapist, an occupational therapist, or some other professional. So those two types of visits are sort of at the opposite end of the spectrum, where social visits might be more informal, and then there might be on the other end of the spectrum more formal visits. A couple other types of visits I want to highlight are our Read With Me program. We also have a Walk With Me program. Read With Me, as you can guess, are visits that are based in literacy or reading, often involving children. So our teams will frequently go into libraries or into schools, and the children, in most cases, like I said, they are children, will read to the animals. An animal can often feel non-judgmental. Once again, there is that motivation and fun factor. If you do want to participate and Read With Me, once you become a team, it is a free program that you can enroll in. And it provides, webinars and education resources, a manual to help you really grow in your journey as a volunteer who's involved in these types of literacy programs. We also have Walk With Me, which again, as the title suggests, it involves walking and physical activity and leveraging our therapy animal teams and our volunteers to help get people in their community out and walking and moving. This is obviously especially a good fit for canine teams, although oftentimes miniature horse teams participate in these types of visits as well. The last one I'm going to highlight visits that are stress breaks. So these can be social in nature as well, but I did want to point out that they often happen in university settings during finals week, or when first year students are moving in and maybe leaving their family for the first time. They can also happen at airports where there's a lot of traveler stress. So teams can get involved in stress break type visits as well. So that's just an overview of what visits look like, and we can go to the next slide. Oh, I'm seeing in the comments now that my voice was cutting out. I hope that has been solved at this point. I'm going to assume so, since I haven't seen it in a little bit, but put it in the comments if we're still having a hard time. Again, as I said at the top of the live, it seems like we have a lot of dog teams here today. That is our most common species, but I do want to be very clear that we are welcoming and always looking for some of these less common species, which are all accepted within pet partners. As you can imagine, there are some things that a rabbit can do quite well that maybe a dog can't do, especially sit in laps or engage in a different way. And obviously, there are some people who are fearful of dogs or allergic to dogs. So it is really wonderful to have so many different species involved in the Pet Partners program. We can go to the next slide. All right, so we've talked about where visits take place, what they look like. And so let's move on to talking about what is the volunteer commitment. At Pet Partners, we really believe that your volunteer journey is your own. So the commitment, to a degree, is really up to you. If you have time to visit just once a month or once every couple of months, that's totally okay. If you're somebody who has time to visit a few times a week, that's also okay. If you're somebody who wants to visit at just one facility, say you're really passionate about your local library reading program and that's all you want to do, that is totally fine. If you're somebody who likes a little bit of diversity in where you visit and you want to go to the library one week and to the hospital the next week, that is also okay. So you really get to design the journey yourself. The main thing is that we don't allow teams to visit more than 2 hours per day. So even if you're somebody who loves this, you can't be volunteering for 6, 7, or 8 hours a day. That is the main kind of limitation on time. The other thing to consider as you're wondering how Pet Partners might fit into your schedule or what your personal commitment might look like is to consider that there is some time to prepare and to unwind from visits. Your animal particularly is likely to become quite tired by visiting, even if they love it. In fact, if we've got some volunteers in the comments, let me know if you've experienced that with your animal, where they go on a visit, they have a great time, but then they sort of crash when they get home, they're tired. So planning for that unwinding time is important, but the preparation time is important as well. Grooming and cleanliness of animals is incredibly important, not just because it makes them more pleasant to look at or to pet, but also because of, infection prevention and control. Clean animals make environments stay clean. And so whenever you're considering how often you want to visit, you need to think about that. Many of our teams won't visit more than once a week just because that bathing and grooming is something they don't want to be doing more often than that. Um, so that's mostly what I want to say about the commitment, and we can go to the next slide. I'm just looking at the comments here, making sure I'm not missing anything. So again, I do see some volunteers who are already registered with us. If you want to make any comments about how you kind of prepare your animal and then unwind your animal after a visit, you can kind of type those in as I'm moving on. I just think that's a really important thing for prospective volunteers to know. So I hope that I've set the context well in terms of what a Pet Partners volunteer experience looks like once you are a volunteer. So now I want to do that backing up that I mentioned and actually talk about what does it take to become a volunteer? What is that process? The first thing really is to consider, of course, is your animal eligible? For dogs, they need to be at least 1 year old. Now, you may have adopted an older dog, say a 3 or 4 year old. And that's where kind of bullet 2 comes into play, which also means the length of ownership matters. So we want to see for most species that you've owned the animal for at least 6 months. So you have to consider both age and how long they've lived in your home. Also, all animals must be house trained. The only exception for that is on birds, but I don't see any bird handlers today, so we won't get into that. We are looking for all animals who can reliably wear a harness and a leash. That goes for non-canines as well. So an animal has to be leash trained or comfortable with the leash. No raw protein diets are allowed. That is for infection prevention and control reasons. No animals who have a history of aggression of any type are allowed into the program. And then the last, well, I guess it's the second to last one, is just looking at an animal's overall health. So we do have animals in the program who might have a long-term health issue that they are maintaining. We also have animals that have disabilities. Those things are acceptable, but we want to make sure that the animal is healthy enough to enjoy visiting. So if the health is compromised to the point where the animal might experience excessive fatigue or excessive pain from going out into the community and going up and down stairs or up and down elevators or in and out different rooms or being handled by a variety of people, we wouldn't want animals like that to be in the program, not because they may not make wonderful therapy animals, they might, but our primary concern is animal welfare and well-being when we're looking at something like this. Our animals are not tools. This is not a job. They are not working animals, right? Service or assistance animals are working animals. Therapy animals are not. So we don't want to be pushing animals to their limits in terms of any physical issues they may have. In terms of medications, there are some medications that animals cannot take, and I am not going to get into that list right now. If your animal is on a medication long term, I highly suggest that you reach out to Pet Partners. We can throw the contact us link. That's how you can reach us in the comments at some point during this live. Reach out to us and let us know what that medication is. We'd like to talk it through with you, take a look at what it is before you get too far in the process. So many medications are okay. There are a select few that are not okay. And then of course, animals must have some basic obedience skills, and we'll get a little bit more into that in just a moment here. Let's go to the next slide. So if your animal meets all the requirements that I just stated, that's important, but let's talk about some of the more intangibles, right? Or things that you can't look at, the animal's birth certificate and say, okay, they meet the requirements. Some of these things might take a little bit longer to kind of suss out and determine about your animal. So first of all, we want animals, of course, to be people-oriented, sociable, and friendly. But I always like to remind people when I share this point that means people-oriented, sociable, and friendly with strangers and with diverse types of people. So I know in the past, before I joined Pet Partners, I really wanted to register with my dog Rhodey because he was calm, he was predictable, he was such a great interactor. But then I had to step back and realize but not immediately with strangers. It took him 2 or 3 times of meeting somebody before he was really people oriented. And with a therapy animal, because strangers um, are the people you're going to encounter, even if you go to the same facility every week, you're still going to see strangers all the time out in public. We need that same people orientation personality, even with strangers. Of course, they need to have basic obedience skills. There are species-specific obedience skills. So dogs, these are probably pretty well known. Sit, stay, come when called, things of that nature. We do have species-specific obedience skills for the other species that we register. But we are not looking for obedience stars. Your animal does not need to have completed, level 3 obedience or participate in obedience trials. We're really looking for animals to be reliable, predictable, and manageable with their skills and their behaviors and their response to you as a handler. Of course, animals who are out in the community serving as therapy animals need to remain calm, and they need to be comfortable being touched by others, sometimes in a clumsy way that they are not used to being pet. Like in their home environment or in their neighborhood or whatever their day-to-day looks like, depending on the types of clients or patients or students your animal's interacting with, the pets may feel a little bit different. And of course, non-aggressive towards people, which we've already covered, but it's really important that animals are also non-aggressive towards other animals. The reason for that is, as therapy animal volunteerism grows, a lot of our teams will encounter other teams on visits, whether or not they plan to both be there that same day. Also very common to encounter emotional support animals, to encounter service animals, to encounter pets. As more and more places become pet friendly, it wouldn't be uncommon to come across another dog, for example. So we also need animals to be non-aggressive towards other animals. So um, let's move to the next slide. I'm going to look at the comments here. Lynn, I see your question here about, are we going to talk about specific training? We are going to talk a little bit about that. So when we get to that, if you have more questions, you certainly can throw them in the comments. At Pet Partners, we always talk about the fact that a team is 50% animal and 50% human. It is very common for folks to want to focus on the animal. The animal is what makes the team successful. What does my animal need? My animal's so great, things like that. But really, the handler is 50% of that team. And some would argue the more important member of that team, because you have more agency, more ability to make decisions, to advocate for your animal, things like that. And we'll talk a little bit more about this important teamwork when we get to our training and evaluation section. But because humans are so important, we also consider what makes a successful handler. Of course, handlers also need to be friendly and polite, just like their animals, and comfortable interacting with strangers. We're also looking for handlers who can predict and redirect their animal's behavior. So that means being a proactive handler, not a reactive handler. So a reactive handler is one that might be standing at the end of the leash and saying, "Oh, my dog loves everybody. He likes everything," instead of being more like, what is my dog liking about this interaction, or what am I seeing coming down the hallway, and sort of being proactive and predicting how your animal may respond to different people and to different situations. We are looking for handlers to ensure the animal's well-being at all times. I already mentioned that animal well-being is a priority for everybody at Pet Partners. Yes, we care about the patients, the clients, and the students we are visiting, absolutely. But when you are a handler, your number one responsibility is to your animal, keeping them safe, keeping them healthy, keeping them engaged, recognizing when they're stressed, recognizing when they're done for the day. So we really want our handlers to always be thinking about animal well-being. And of course, handlers must follow Pet Partners policies and procedures. We have many, and they are covered in the training. But the reason the policies and procedures are there is to keep everybody safe and to keep the interactions as effective as possible. So, okay, I see a comment that came in. Do you have specific locations, this is from Celeste, that you work with, or does the team locate their own facilities in which to volunteer? So, Both and is the answer. So we do have a volunteer opportunities directory on our website, and there are currently, last I checked, between 400 and 500 volunteer opportunities in that directory. That might not be 500 separate facilities. It might be a couple of different opportunities at the same facility or in the same program. You're absolutely welcome to look at that and pick a volunteer opportunity from there. Really, that just puts you directly in touch with the facility. In fact, if you're a prospective volunteer, you can go take a look at that directory even before you're a registered team, just to get a sense of what might be in your community. So some teams use that. Many teams do make their own relationships with facilities, and they locate facilities themselves. This could be because they may have a parent who is already, living at a senior care home. They may have a child in the local school. They may have had an experience volunteering at a hospital without an animal before, and they want to go back with the animal. So we do have a lot of handlers who self-locate their own facilities, but we do also make that directory available to you. That's a great question. Okay, so up on your screen is just an overview of the steps to become a Pet Partners Therapy Animal Team. So if you know your animal meets the requirements, you feel like they have the right temperament, you feel like you have the right temperament, then it's time to think about, okay, what are the steps? And this list is not exhaustive, but these are the main steps, and the ones that I want to talk about today particularly are steps 2 and 4. Step 1, of course, is to create an account. You can do that from our website. Step 3 is that your veterinarian has to fill out a health screening form. Nothing on that health screening form would be, I think, terribly surprising to most animal owners. So I really want to focus on step 2, which is training, and step 4, which is the evaluation. So let's take a peek at those on the next slide. All right, handler training. So this is a little bit to your question, Lynn, about specific training. So when it comes to the team, we don't require any specific training protocol for the animal. There are a couple of reasons for that. Number one, not all of our animals are dogs. So if we said you need to do the CGC or you need to do level 1 and level 2 obedience, obviously if you have a rabbit or a horse or a llama or a pig, you cannot meet those requirements, because in most places there is not that type of training for those species. So that's one reason. Probably an equally important reason is that um, animals are coming into this possible volunteer role at very different phases of life. So some people have already trained their animal through obedience, or maybe they've done agility or scent work, or the animal is just an older, really calm, mild-mannered dog, for example, and doesn't need that much training to get to where they need to be a successful therapy animal team. That might be very different than a 1-year-old dog who still needs some training. So we believe that you as the handler can determine how you want to train your animal for this type of volunteerism. Again, for some animals, the training is not extensive because the temperament is already there. Some of the basic obedience skills are there. So it is just a matter of maybe exposing them to some different types of environments or distractions, practicing skills, but you may be almost all the way there. Whereas other teams might take a year or two of training to kind of get where they need to be. So we don't have a particular protocol, just because we recognize that diversity of species and the diversity of the kind of point at which the animal might be entering the therapy animal program. Instead, what we do in our required training, and this is something you must do to become a Pet Partners team, we focus on the human end of the leash, the handler training. And once you take that training, it gives you a really good sense of what is it that I need to do and what is it that my animal needs to do to be a successful therapy animal team. The handler course that we require can be taken either online or in person. They are equally good courses in that the outcomes for teams in terms of them passing the evaluation and becoming a registered therapy animal team are virtually the same, no matter what format you take. It kind of really depends on your personal learning style. There are pros and cons. Of course, the online training is very convenient. You can kind of come and go from it. You don't have to sit down and do it all in one day. You could take a couple of weeks, a couple of months, whereas the in-person is one longer day. But of course, you get to interact with other prospective volunteers. You get to have an instructor in front of you where you can maybe ask more questions. So again, pros and cons to both. I will say right now, As you can imagine, with the pandemic, many of our in-person workshops for the required handler training kind of shut down for a while, understandably, and they're a little bit slow to come back. So you may not see as many out there on our online calendar where you can sign up for the workshop as we might normally have. But of course, you can take the online course if it's not available in your community. So I'm just going to do a quick tech check-in. I'm seeing that my slides are no longer showing for me. There they are. Okay, great. Thanks, Bree. Um, so that's a little bit about training. Again, if you are an existing volunteer or registered volunteer and you're on right now and you want to talk about what you did to train your animal, I would absolutely welcome you putting those right in the comments, just so that some of our prospective volunteers get a chance to see, what you decided to do for your teammate, for your animal. Once the handler's course is complete, you are eligible to take the Pet Partners team evaluation. And there are over 20 exercises in the evaluation, close to 30. The first half of the evaluation is basic obedience skills. The second half of the evaluation is what we call aptitude. So we're actually going to put you and your animal in kind of mini scenarios or situations that might mimic a therapy animal visit. So a loud noise will be made, and we're going to see how you and your animal react. It's actually okay if the animal reacts to a loud noise. What we're looking for is, do you support your animal when they might startle? And how quickly do they recover from startling by a loud noise? Why a loud noise? Because you can imagine if you volunteer in schools, the dismissal bell rings, or you're in a hospital and some sort of alarm goes off. Indicating an emergency somewhere in the hospital. So in a lot of therapy animal situations, you're going to hear loud noises. Also, in that sort of second half of the evaluation, another example is, you'll have somebody approach you with a piece of medical equipment. Again, we want to see what is your animal's response to interacting with somebody who may be seated in a wheelchair or who may be using a walker or a cane. So that's sort of how the evaluation flows from obedience to more aptitude. The evaluation differs by species, although it still follows that same general flow, no matter what the species is. In each exercise, you, as the handler, receive a score, and your animal receives a score. So you are scored kind of separately and together throughout the evaluation. So that means your animal could be a superstar, but if you aren't doing what you need to do as a handler, you still may not pass the evaluation. If you can't tell, I'm going to keep emphasizing that human end of the leash and how important that is to pet partners. You are the being with the most agency. You are the one who can control the interactions a little bit more. So we're really looking to you to show that during the evaluation. So what we're looking for a lot with humans during the evaluation is, are you using what we call PETS, which is an acronym: presence, eye contact, touch, and speech. So are you staying close to your animal? Are you making eye contact with your animal? Are you touching your animal? Are you talking to your animal? These are all things that animals need to feel supported, to reduce their stress, to have them have healthy interactions with other people, because you're the person they trust most. So you'll be scored on things like that during the evaluation. Or we really like when handlers do things like, say somebody is approaching you with a piece of medical equipment. Let's say it's a walker. We want to see you say to the person, my dog would really love a pet from you. Is it okay if I approach from the side? I think that's where he would like to approach you. So again, advocating for your animal in terms of what would make that interaction easiest for your animal and most enjoyable for your animal. So again, the evaluation, many exercises, some obedience, some aptitude, and we're always looking at the teamwork and looking at you as a handler and your animal. And then if you pass the evaluation, you then become registered with Pet Partners. So you're eligible to be registered with Pet Partners, which means you can then go out, volunteer on our behalf. You have access to our insurance and things like that. Let's go to the next slide, which I believe is the last one, and then I can hang out for some questions. Yep, this is the last one. So as I said, you complete your evaluation. Now you're eligible to become a registered volunteer with Pet Partners. Up on your screen, it's just some of the benefits to registration. Liability insurance is the one that I do always point out, because 99% of facilities are going to require that you have liability insurance, which Pet Partners provides for you as a volunteer. No hospital or school or airport or university is going to let a team in without that certificate of insurance. So that is probably the primary benefit, at least in terms of getting started right away. But I do also like to point out that what really sets us apart, I think, from a lot of other therapy animal organizations is our access to continuing education and resources. We believe that being a team with pet partners is a journey. You will grow, you will get better over time. Your bond with your animal will grow deeper than maybe you ever thought possible. We want to give you the resources and the education to make this a journey that you can do for years to come, maybe not only with the animal you have currently, but maybe with a future animal as well. So we really pride ourselves, and our volunteers really appreciate that we make so many of those resources and so much of that education free to volunteers throughout their time with us as pet partners, at Pet Partners. So I am going to stop there. I am going to look in the comments and see what's been coming in that I may have missed, but please keep the questions coming. I can definitely hang out for another 10 or 15 minutes easily. Okay, so I see that Kimberly Jackson has talked about what she's done training. And so I want to talk a little bit about that because I kind of skipped over that part. I usually do talk about this, but um, as I kind of mentioned, a lot of animals may have the right temperament to be a therapy animal. They've already maybe gone through some obedience training or some at-home training, but it's still really beneficial to expose animals to a variety of different environments and also to a variety of different distractions. So taking your animal to the Home Depot or the local hardware store if it's pet friendly, having them with you on a patio at a pet friendly restaurant, maybe going to a park where a lot of children are present and kind of walking the perimeter and letting your animal hear, you know, frankly, I have kids, so I can say this, the screams or the squeals of young children. And really kind of getting them used to that in ways that maybe you didn't think of before you wanted to kind of embark on this journey. I also think introducing distractions is really important. And this is more dog specific, but I think a lot of us that experience with, our animal will follow the obedience commands we may provide, but then a distraction comes and they may not be as consistent with it. So practicing a lot through distractions, because when you as a team go in for an evaluation, we intentionally introduce distractions to see if you and your animal can stay connected and if your animal can still follow commands despite those distractions. So those are things to practice on. Kimberly, I hope I'm kind of encapsulating what you were trying to get at in terms of training in pet-friendly places. Great question here. If you do not pass the evaluation, can you retake at a later date? Absolutely. Actually, if you don't pass, what we call it is not ready. It just means that day you and your animal did not demonstrate the skills and aptitude that day. You're not ready yet to be a therapy animal team. I believe it's somewhere between 30 and 40% of people actually get a not ready score at their first evaluation. Now, some of this is because of lack of preparation. So I really, really want to encourage you to pay close attention to that handler's course. A lot of times people are not ready. They come in because they kind of underestimated what to expect at the evaluation. So study up, and a lot of not readies can be prevented just by knowing what to expect. And others, it's just, it's an overwhelming experience. It can be a little bit nerve-wracking, as welcoming as our evaluators try to be. So sometimes not readies happen. It's totally a normal thing. And you can come back and try again at a later date. For some people, they'll try again 2 weeks later and they'll be really successful. Others realize, okay, I need more like 2 or 3 months to feel comfortable with what's being asked of me at the evaluation. So absolutely can try again. Great question here from Liz about a small dog. Yes, we do have a very small dog protocol where you can do some caring of your animal. Absolutely. There's actually a whole evaluation protocol for them. So that is a possibility. I always encourage people in this situation with very small dogs to reach out and talk to us about it first, or when you sign up for an evaluation, making sure you let the evaluator know, I plan to carry my very small dog. So that is a possibility. Question here about halter and collar. What type is required? it's more about what's not allowed. We don't allow prong or choke collars, for example. We don't allow slip collars. If you go into, if you have a volunteer center account, which if you don't, I highly encourage you to get one. Again, you can do that right on our website. If you go and log into the volunteer center account, then there's like a big brown box right on your homepage that says resources. And you can get a volunteer center account even if you don't end up volunteering or you're just thinking about it. But when you click on that resources and you open it up, you can type in equipment and you can see a list of all of the equipment we allow or disallow. Or to the small dog question, you can type that in, small dogs, and you'll be able to see a little bit more information specific to your question. So I can't get into the list of the equipment right now. It would be quite long. But again, it's more about what's not allowed than what is allowed. The majority of people use a standard flat collar or kind of just a standard flat harness. Harness is not required. If you want to just use a collar, you do not have to use a harness. I'm assuming this is for dogs. Can you use treats during testing? That's also a great question. No, you cannot use treats during testing. So they cannot be on your body. You cannot entice your animal with treats in any way. There is one exercise at the very end of the evaluation where the evaluator will say to you, may I offer your animal a treat? And you can say yes, or you can say no. Some people, especially if their animal isn't super polite, in terms of taking treats, maybe they don't have a soft mouth, they will decline. Or you can say yes. And if you say yes, then you're going to be scored on if your animal can take that treat kindly and nicely. But that is more not in terms of using treats as an enticement to follow commands. That is us actually testing your animal's ability to remain composed around food. Because again, there's going to be a lot of therapy animal environments where food is going to be present, and we want to know that your animal is reliable around food. But you cannot have them on your body. In fact, most evaluators will ask when you get there, do you have treats? And then they will set them aside if anybody shows up with them. So if you have a very treat-oriented animal that you've been using that a lot during training, I do it with my dog, who's not a therapy animal, so she always gets treats. You are going to have to start working towards training and having your animal work with you on commands without treats before you sign up for that evaluation. I would give that a good on-ramp if you especially have a very food-motivated animal. Maria, question here about your animal's age. Absolutely, we do not have an upper limit on age for animals. I would, of course, consider with any older dog whether or not joints are getting uncomfortable, getting up and down is uncomfortable, laying on hard surfaces is uncomfortable. But if those things are not at play, then there is no upper limit. There's a lower limit for dogs. They have to be over a year old, but there is no upper limit. Looking at what other questions are coming in. I think I've hit most of them. There is one thing I did forget to mention with evaluation, so I'll wrap on this, or I'll at least give you a minute or two to put in questions while I talk about this, is our evaluation process is required for new teams. We also require it every 2 years for existing teams. We call that a renewal evaluation. So our process is not set it and forget it. It's a continual process of making sure that this continues to be the right volunteerism for you and your animal. So as you can imagine, animals age or animals experience health changes, humans experience health changes. A lot can happen in 2 years. So you do have to come back and redo the evaluation every 2 years in order to remain registered. You do not need to retake the course. So it's an easier process, a quicker process when you're renewing, but that evaluation is required. How often are evaluations offered? So this really depends on where you live. I live in Minneapolis, St. Paul, where we have a very large group of volunteers in this area. Evaluations are probably offered 2 to 3 times a month here. In other areas where there might be just lower population in general or fewer pet partners teams, they might only be offered 3 times a year. We do have an online calendar. So again, if you create a volunteer center account, and you begin a registration, there's a big brown box that says start a registration. Again, you can start one without obligation to complete it. But one of the steps in there is sign up for an evaluation. If you click on that, you can get to the calendar and see what's available in your area. If you don't see anything in your area upcoming, you can always reach out to us and we can creatively brainstorm how to help you. I will say, though, that it is not uncommon to wait 3, 4, 5 months to get an evaluation. So if you go now in May to sign up for an evaluation and it's not taking place until September, that feels like a really long time. But with the demand for our evaluations, I would snag that spot. I know people get really excited and they're ready and they want to, they want to evaluate 2 weeks from now so that they can be volunteering, but it's not abnormal to wait 90 days to have your evaluation kind of come to fruition. So that's a long answer, but it just really depends on where you live in terms of how frequent they are. In terms of a cost for the evaluation, there may be or there may not be. So our evaluators are volunteers as well. They are licensed. They go through a special set of training with us at PEP Partners to hold that role. And then they hold these evaluations in their community. Oftentimes they hold them in, church basements or community center halls, things like that. And sometimes there is a fee associated with that space or with what they need for the day. Sometimes they need to make photocopies or they need things like that. They are allowed to pass that cost on to handlers. So if it costs them $200 to put on the event, and they have 8 handlers there, I think that equals $25 a handler. My math's not always great, but they are allowed to pass that cost on to handlers because, again, remember, they themselves are volunteers and they are there all day. So we don't also want them to absorb the costs. In other places, people are able to get everything donated. And so there is no cost and you'll see $0 for the evaluation. So it just depends, again, on where you live and the evaluators in your area and what they're able to secure. Somebody has a question here about our crisis team. So this is probably in reference to our Animal Assisted Crisis Response Program. The acronym for that is AACR. You can become an AACR team once you have been a handler for at least 6 months. So you have to become a team first, and then you have to visit a little bit, and then you can layer in that credential. In order to layer in that credential, you have to take some coursework, but there is not a separate evaluation. So the coursework's all online as well. So it can be a pretty seamless process, but we do want you to actually become a team first, do some visiting first, because that helps you get to understand your animal in a therapy animal visit environment. Then you can layer in AACR after that. That's different than read with me and walk with me, which I talked about earlier. Those are things that you can do right away. Those aren't credentials. Those are just programs with kind of special education and resources available to them. AACR is a credential that you can earn as a team. Okay, I think that is all of the questions I see. So I am going to sign off here. We have the contact us link if you have any further questions. I also have my personal email there, direct to my Pet Partners inbox. You're absolutely welcome to email me directly about anything you heard today. And I want to thank you so much for your time. I really hope that many of you consider joining us at Pet Partners. We would love to have you. So have a wonderful day. Thank you.